In 1979, the Pan Am Clinic was launched to fill a gap in Winnipeg's healthcare needs.
What we started was a multidisciplinary approach. So we had athletic therapists, we had physiotherapists, we had radiology, we had orthopedic surgeons, we had primary care physicians providing this ongoing care. And that had never been done.
The clinic was ahead of the curve as the human and economic toll taken by muscle, bone, and joint conditions was just beginning to be realized. Not just sports and work injuries, but conditions such as arthritis and rheumatism were diminishing the lives of more and more people every day. Pan Am's multidisciplinary approach was a revelation.
It's not only convenient for the patient having everything under one roof, but it's also promotes interaction.
And that's definitely one of the advantages of the Pan Am Clinic is it's a multidisciplinary setting, and we can go down and talk to somebody in sports medicine and go right up and talk to a surgeon.
Today, the Pan Am Clinic has evolved to deliver a comprehensive range of muscle, bone, and joint care, emphasizing rapid response, early and aggressive treatment, and improving patient outcomes.
I started golfing about 1960, and then unfortunately for 2 years I didn't golf at all. My shoulder gave out on me, just wore out. So it took them about 6 months, from the time I first went until I had the operation done.
We have great staff, we have great surgeons, great nurses, great physiotherapists, great athletic therapists, and they can hold their own against any standard you want in the world.
I got my new shoulder just about a year ago now, and hey, I'm golfing again. It just restored the quality of life for me, and I think that's important.
The multidisciplinary approach provides patients with a one-stop shop throughout the continuum of their treatment and recovery.
Patient navigation and access is truly an innovative program. And what we're talking about is a patient-centered program.
When you're a band teacher like I am, you need to do a lot of standing. And it was becoming problematic to stand for an evening and conduct the bands. I ended up getting knee surgery. I feel like they engage you more. You feel like you're in partnership with what's going on.
The Pan Am team of healthcare professionals is driven to innovate, to find more effective ways to enhance treatment and improve quality of life. In 2008, the Pan Am Clinic opened the doors to the David and Ruth Asper Research Center, which raised the clinic to an entirely new level of healthcare service.
If we do a major research project and it shows that a certain operation is not as good as another one, the entire sports medicine world will benefit.
The skill level of the doctors and the medical team is of such a level, and there's such curiosity and such a desire by the medical team to really look for new frontiers.
When 18-year-old Todd Davison, an elite hockey player, was diagnosed with a tumor in his shoulder, the Pan Am Clinic team went to work. They discovered a source for a surgery that could save his arm and then developed a treatment and rehabilitation regime that would allow him to keep doing the things that he loved to do, playing and coaching hockey, and establishing a foundation to assist other cancer victims.
The program here is very exciting. Since I've been here last time, we've now got the research lab, we've got this great facility here, operating room and patient examining rooms, rehabilitation, all in one facility. I mean, that's really phenomenal for a patient to come and take advantage of that.
The development of such specialized research and skills labs is a perfect complement to the existing and developing fellowship programs at the Pan Am Clinic. These programs are fully endorsed by the University of Manitoba's Faculty of Medicine and will soon be nationally accredited.
Currently, I am the Fellowship Director for the Primary Care Sports Medicine program. We're talking about cutting-edge modalities for up-and-coming orthopedic surgeons and also our primary care sport physicians coming through this program. We have the resources, we have all the technology here. This is what we need to attract our young physicians and surgeons.
And we're looking at a surgical skills lab, which is training orthopedic surgeons like they would a pilot. So we're actually putting them in a virtual reality simulator and they can practice that type of surgery.
When you have a skill lab like that, you can practice something that's not common, and so you can practice uncommon things a couple of times in the same day.
Both patients and the healthcare team benefit immensely from the new research facilities at the clinic. Not only does it provide the team a chance to hone their skills and experiment with new therapeutic ideas, the clinic also benefits by attracting new fellows and residents to Manitoba who are keen to develop new skills with the clinic's state-of-the-art equipment and unique learning environment.
It's nice being in a location with other professionals that are kind of leaders in their field. The expertise is astounding, and there's a lot of resources here that make it very enticing to come back to Winnipeg.
The Pan Am Clinic does offer an excellent location for both outpatient clinics and operative exposures, good size of an operating room. And then the educational part of it, I haven't seen anywhere else, so it's definitely above and beyond what I've seen.
We're working on community outreach, educational aspects of things. We've got research, tremendous programs that are designed to improve the quality of patient care.
The Pan Am Clinic is developing several groundbreaking outreach programs, including Pan Am TV, a series of short health-related videos. The clinic is also host to a series of training and skill-building programs offered to community members of all ages.
Here's an opportunity to do something different and new, and take a fresh approach to how we're going to construct community-based healthcare.
Things are done differently, things are done innovatively here. It shows short-term results. I think that's where a donor is going to be very pleased to see the results of that kind of an investment.
Its desire to be a center of excellence is what really sets it apart.
An insatiable desire to remain at the forefront of discovery, innovation, and education drives the Pan Am team. Their goal is to be a community leader, a national leader, and a world leader, an inspiring new model for community-based healthcare.
None of the operations I did 5 years ago, I do exactly the same as I do now. So it's a constantly evolving field, and that's what makes it so exciting.
And we're not happy with just being a world-class facility 1 year. We've got to keep that up and maintain it and continue to grow the image of the Pan Am Clinic around the world.
People can get the best care here, as good a care as they can get anywhere in North America or anywhere in the world. And that's what we have to build on going into the future.